Howdy, y'all. In this video, we're going to talk a little bit about euthanasia, and this is a companion to the Ethical Issues in Modern Medicine, Part 3, Section 5. I'm going to start this discussion by talking about the supposed difference between active and passive euthanasia. So, in medicine, it is fairly well believed that there is a moral distinction between active and passive euthanasia. And I want to start just by unpacking this distinction a little bit, just to think about whether or not there really is a morally relevant distinction. I think part of what you get in the reading, at least at the theoretical level, is that there isn't really much of a distinction between actively killing someone and passively letting somebody die, at least if you hold a bunch of other things equal. And a lot of the pushback against allowing active euthanasia is more at a practical level. The concern that many people have is not necessarily that active euthanasia can never be justified, but rather that if we allow it, we set ourselves down a slippery slope. So we'll talk a little bit about that slippery slope later in this video, but I think most of the attention that we should have would be at the theoretical level, just thinking at sort of a moral distinction and whether or not it really matters. So we're going to start just by talking about some distinctions here. So on the slide, you'll see that the first distinction that I have is the distinction between sort of killing and letting die. And I think that is what the active passive distinction is supposed to map onto. But of course, that leaves open the question of what does that mean? What does it mean for something to be sort of a killing versus a letting die? So the first and most sort of obvious distinction comes up with sort of the distinction between sort of a doing and allowing, or what we call sort of acts of commission, where we perform an action versus an act of omission, where we refrain from taking an action. So it's the difference between uh, unplugging a machine or just standing there, right? Or administering a drug versus failing to administer a drug. Uh, so typically that's where people try to uh, make this sort of distinction, but as we're going to see with one of the Rachel's cases, that distinction may not make a whole lot of sense. And so um, there's some other distinctions that people sort of bring up in this discussion that is important to keep in mind as you kind of think about things. And one of them, which is one that we've already briefly seen in the introduction to this text, which is the distinction between sort of intending harm and foreseeing harm. So this is the doctrine of double effect. So whether or not you intend the harm to sort of come about or you merely sort of foresee the harm, that may sort of map on to this distinction, although that's not always the case, that whether you're actively doing something or allowing something to happen may not map on to sort of intending versus foreseeing. There's this other distinction that you might want to sort of think about, which is the difference between sort of a guarantee of harm and merely sort of raising the probability of harm. So a lot of people, when they think about killing versus letting die, or when they think of acts of commission versus omission, they think that typically the action uh, will bring about sort of a guarantee of harm, or at least a harm that is much more likely to sort of come about than if you sort of merely allow something to occur. And again, that may sometimes be the case, But that's certainly not always going to be the case. It may be the case that the guaranteed harm is going to come about from an act of omission, whereas an act of commission is actually sort of less probable. Um, so a lot of these distinctions really sort of muddy the waters between or in sort of thinking about the distinction between killing versus letting die, which again is supposed to be the distinction between active and passive euthanasia. So one thing that I want to do is to talk about a philosopher by the name of James Rachels, who really sort of gets into actually sort of making an argument that there isn't really much of a distinction between active and passive euthanasia, that the act of killing somebody versus the act of letting somebody die um, may not really be all that morally relevant. And in fact, there may be some cases in which active killing may be morally preferable to passive killing or passive allowing, I should say. And so that gets to sort of one of his cases that he brings up to try to make this case, which is something that occurs in medicine because passive euthanasia is allowed, right? That passive euthanasia or withholding treatment is something that we can do, and it's something that we could do with children at the request of their parents. So by honoring a parent's request, we could passively let an infant die if certain circumstances are met. And one of those circumstances that he discusses is a Down syndrome infant who may be born with sort of an intestinal blockage. Now, if you're born with an intestinal blockage, that is going to sort of pretty much sort of guarantee death unless you engage in a pretty risky surgery. In fact, a very risky surgery, such that the chance of living is very, very small. And parents who are faced with this situation are allowed to let the child die, which is to say that passive euthanasia is an acceptable, or at least legal, option for these individuals. And what Rachel says is, well, look, by allowing this infant to die, you're essentially sort of consigning it to a death through dehydration, and you can sort of make the infant comfortable, I suppose, but the death will be, or at least involve some amount of suffering. Um, And what Rachel's argues is that, well, if you're going to do this, right, if the end result is the death of the infant, it would actually be better from his point of view to kill the infant, right? That it would at least involve less suffering. Um, and and we're going to talk about this more when we sort of talk about pets, but this is essentially this sort of utilitarian kind of way of thinking about things is if you are going to sort of bring about a certain effect, well, you should do that with the least amount of suffering possible. So if we're already going to bring about the death of the child through inaction, through omission, it might actually be preferable to do it through commission because that would allow, or that would cause sort of less suffering. So more on that here in a second when we talk about pets. But let's talk about Rachel's other case as well. Rachel's has this case about that has kind of to do with sort of these other distinctions of intending versus foreseeing, or guaranteed versus sort of probable harm, or risk to yourself, or whatever. And one of the things he wants to do is to kind of really put the focus on this idea of an action versus an omission, where you are sort of actively doing something as opposed to refraining from doing something, and really asking whether or not there's really much of a distinction there. And what he does is he imagines sort of cases. This is like an experiment, but a thought experiment where you hold sort of every variable equal except for the one thing that you're trying to think about, right? This commission versus omission distinction. And and so what he does is he says, well, imagine this sort of scenario where you intend to kill somebody, right? Where you have this sort of evil intent, and you're going to go drown your small cousin that your small cousin is taking a bath, and you're gonna and for whatever reason, maybe you're gonna get an inheritance or something, but you decide that you're gonna go sort of drown your cousin who's taking a bath. So we hold all this equal that your intention is to kill your cousin. You're going upstairs to sort of kill your cousin and drown them. But in one scenario, you sort of come into the bathroom and your cousin has already been knocked unconscious. So suppose that they hit their head on something and they're unconscious. And in the first scenario, their head is already underwater, right? That they are already drowning. And in order to sort of kill them, all you have to do is hold your head or hold your hand over their head just to make sure they don't sort of pop back up, right? So in this sort of scenario, you don't actually do anything, right? That you are just kind of sitting there, standing there, allowing them to die, right? By not performing an easy rescue, you allow them to die because their head is already underwater. They're going to drown anyway. You don't actually have to do anything. So that's scenario one, right? That's the omission sort of example. And in that case, you might say, well, that's bad, but it's not as bad, maybe, as actually sort of killing him. So scenario two. Scenario two is you walk into the bathroom, the kid is unconscious, but his head is above water, right? He's not actually drowning, so he's breathing just fine. And so in order to drown him, you have to actively sort of push his head underwater. And so that's what you do, right? So so imagine that you push the cousin's head underwater, or maybe it's not. Yes, you just push the cousin's head underwater, and then hold your hand over to make sure he doesn't pop back up. So the only difference here in the two cases is that in scenario one, you don't actually do anything, right? You just hold your hand over the head, make sure he doesn't sort of pop back up. Counterfactually, you would have done something if his head did pop up, but that didn't happen. And in scenario two, you actively do something, right? You push his head down. So the purpose of this case is supposed to kind of pump your intuitions, right? To make you sort of think about, is there really sort of a difference between these two cases? And for Rachel's at least, and a lot of other individuals, when they look at these two cases, uh, they would say that you or the killer, or I forgot in the story who's what here, but the person who either holds their hand over the head of the child or pushes the head underwater is sort of equally guilty of murder, right? Or they're equally sort of killers of the child, despite the fact that one involved an act of pushing the head under the water, and the other didn't, right? The other was just a letting die, or at least didn't involve sort of an act of killing. So if this is true, that there isn't sort of much of a difference, then that sort of troubles this idea that at least theoretically there's any difference between active and passive euthanasia. All right, so let's talk about pets for a little bit. That one of the places where we do active, non-voluntary euthanasia is with our pets. I have euthanized a number of pets in my lifetime, and It has always been the thought that that was a morally acceptable thing to do. I didn't think that I was performing a wrong action uh, by doing such an action. So why then is it sort of permissible to euthanize pets actively and non-voluntarily, but impermissible to do so to humans, even voluntarily? So let's start with pets here a little bit. So the first question that I have is, why, assuming that it is morally permissible to euthanize our pets, why is that the case? So one possibility is that pets actually lack moral worth, that euthanizing a cat or a dog is no morally more problematic than killing a mosquito, right? Or killing a plant, right? Yes, you're killing something that is alive, but that thing may lack moral worth. So why would we say that? Well, one possibility or one thing that sort of may distinguish sort of animals from human beings is that pets lack autonomy. So this is something that people like Immanuel Kant would believe, that they think that these animals don't have the capacity to sort of to make choices for themselves, and as a result, they are not morally sort of relevant, and so killing them wouldn't be a problem. The problem with that kind of distinction, though, is that that also kind of leaves out infants, right? So if we're talking about small children or individuals with severe cognitive disabilities, then that would mean they lack moral worth as well. And a lot of people aren't willing to sort of go down that road with regards to human beings who lack autonomy. So usually we sort of look to sort of something else and we say, well, it's not sort of autonomy that sort of matters, but rather the capacity to suffer, sort of some amount of self-awareness that matters. And of course, the trick with that is that, well, animals have that too. Especially cats and dogs, they do not lack the capacity to suffer. And in fact, the reason that we're killing them is because of that capacity to suffer. The reason that we think that it's the right thing to do, at least in the cases where I have euthanized my pets, is because they were suffering. And that furthermore, their suffering would have been sort of unbearable if we were to just sort of allow them to die. So they had, uh, all my animals have had some sort of terminal diagnosis such that if you did nothing, they would die, but they would die in sort of a painful way, right? You could try to make them sort of comfortable, but again, it would just sort of be needless suffering. So the idea here is that precisely because of their moral worth, right? Because precisely because of their capacity to suffer, that we make the decisions that we do. We think of that as a mercy to the animal, to actively and non-voluntarily sort of euthanize it. Because, and again, it's going to be non-voluntary because animals lack the capacity to make decisions for themselves. So moving on. So what about humans then? If it is at least sometimes morally permissible to kill our pets, and it is morally permissible precisely because they have moral value, then why don't we say the same thing about humans? And furthermore, humans do, at least some of them, right, do have the capacity for autonomy. So in some cases, some cases they're actually asking us to be killed. So not only do they have the capacity to suffer, we all know that, but they also have this other feature about them that makes them sort of morally relevant and important sort of subjects, right? They have the capacity to ask and determine their course of life. So if there's a situation in which they are suffering and killing them would end that suffering, right? Like with a pet, And furthermore, they are actually sort of asking to be killed, then how can it sort of not be the right thing to do, right? That we're respecting their autonomy and we're sort of doing what's in the patient's best interest by killing them. That seems to be sort of where at least the people in favor of active euthanasia or physician-assisted suicide, come into with their ideas, right? That their views are that, at least in some cases, this is sort of a morally permissible act. Okay, I want to end this discussion by talking about the slippery slope worry. So, as I mentioned, the one reading that actually sort of argues against allowing voluntary active euthanasia is arguing from the basis of sort of a practical concern. So the concern is that if we don't sort of draw the line somewhere, so I guess drawing the line at voluntary passive, then we're going to be set down a slippery slope into sort of euthanasia practices that are morally problematic. So voluntary active euthanasias themselves may not be sort of morally problematic, but some of the other scenarios would be. And so I wanted to end here just kind of by talking about where the concern is, right, and sort of where we're at right now, at least in the United States. Let's sort of take a look at this chart here as we kind of go through, types of euthanasia that are sort of more and more sort of morally tricky, and more sort of morally are more likely to be sort of morally problematic for people. So on the left here, we start at sort of the top of our slope here, which is voluntary passive. Like voluntary passive euthanasia is something that we allow. That in situations where the patient is competent and autonomous, they can refuse treatment, right? And we are, in some cases, not just sort of allowed to honor that request, but required to honor that request, right? That we cannot force treatment onto competent individuals who don't want it. And so even if that means their death, right? Even if it means they will expire as a result of us not treating a disease or not helping out the patient. So that's allowed, right? That's something that we can do if a patient has a terminal disease and they want to refuse treatment, that can happen. So where things get sort of tricky is where we actually sort of doing something to bring about sort of the death of the person, or facilitating uh, an active doing. So the next sort of step along this slope then would be what we call sort of physician-assisted suicide. So physician-assisted suicide is not quite voluntary active euthanasia in the minds of some people, because what the physician does is they provide the means of the suicide, but does not sort of actively kill the person. So this is the scenario in the first case study from the reading, where you prescribe a prescription for a lethal dose of barbiturates, but don't actively sort of administer them, right? There's no injection of the lethal drug like we do with our pets. We just sort of open the door and allow the patient to take their own life. So there's a bit of action, but not as much as voluntary active euthanasia, which is sort of the next step. But physician-assisted suicide is allowed in some places in the United States. So in most places, it is still illegal. But there are 9 states and the District of Columbia that do allow physician-assisted suicide. Again, that's just the prescription of the drug, is not the active sort of injection, right? That would be voluntary active euthanasia. So in the middle bit here, that's where we have voluntary active euthanasia. It is not allowed in the United States, it would be a situation where the physician is actively sort of doing something. Um, and this is where again the worry is that we're getting further down the slope here, is that this is somehow worse than physician assisted suicide, and voluntary passive euthanasia. So it's illegal in the United States, but it is legal in some places, not a lot, but you can find it in Belgium and the Netherlands and Colombia, maybe Canada, and a couple of other sort of smaller nations, but those are the three sort of main ones. And usually those are for individuals with terminal diseases, especially sort of Colombia makes the distinction, and Canada makes the distinction that um, that the situation that the patients sort of find themselves in is sort of an impending death. So further down then the slippery slope then would be voluntary active or physician assisted suicide for non-terminal cases. So this would be like the Ms. Boomsma situation where the patient isn't actually sort of suffering from a physical ailment that is going to kill them, but rather is suffering from a psychological or sort of mental distress. And again, that's a type of suffering, but it's a type of suffering that alone will not sort of kill the patient. And again, this is getting to sort of more worrisome territory for some people, and it's even sort of less allowed, but it is something that can happen in Belgium and the Netherlands. So the Mrs. Boomsma case was Dutch, I think, and and then that's pretty much where it ends with human beings, at least. I think the worrisome place that most people are worried about, even if we get to sort of voluntary active for non-terminal cases, is non-voluntary or even sort of involuntary active situations. So with pets and humans who are sort of permanently incompetent, we would have a situation where the person is non-voluntarily sort of euthanized, which is to say that they don't have the capacity to make the decision for themselves, and so we would be making it for them. And then even more problematic would be situations where you would be actively going against somebody's will to be killed, right? So somebody has the capacity to make choices for themselves, and we actively kill them anyway, right? That would be the most problematic and the most obviously like murder, uh, if we were to sort of get to that situation. So again, this is kind of the slope that people are worried about. They're worried. I mean, we're already kind of down, at least in some countries, we're already kind of down the slope. So that may give people some reason to think that uh, we should, nip that in the bud, right? We should not allow ourselves to get to that point. And uh, and of course, it's up to us to kind of think about whether or not, or to what extent, these things are really bad or worse. So something for y'all to think about in terms of where you would draw the line. When does this become sort of morally problematic for you with regards to sort of human beings? Or does it not become morally problematic at anywhere? So this is something that we're going to want to discuss a little bit more when we meet. But for now, I think we've discussed sort of enough, at least just to get our distinctions in order and our thoughts organized. So that'll be it for now, and we'll meet here soon enough.